should we go back to wearing face masks? COVID-19 numbers surge once more 2 months after returning to normality. The number of daily new COVID-19 cases has increased for 5 consecutive weeks to surpass 40,000, with figures for seriously ill patients and deaths also showing clear upward trends. The resurgence of infections, which came 2 months after the public health emergency was officially declared as moving toward an endemic phase here, is raising concerns regarding another pandemic wave. With health experts urging the government to be more cautious before deciding to fully lift the remaining indoor mask rules across the country. According to the latest data from the Korea Disease Control and Prevention Agency Tuesday, the daily average for new infections for the week beginning July 25 stood at 45,529, up by 17% from 38,802 tallied the previous week. In particular, 57,220 new cases were reported on July 26 alone, marking the highest figure since June 1 when the country declared the end of the health emergency. What raised more concerns is the increasing rates of seriously ill patients and deaths. The weekly death toll hovered around 40 to 50 until the week beginning July 18 but rose sharply to 97 in the week beginning July 25, marking a 70% increase. The number of seriously ill patients, which was tallied at 110 for the last week of June, has also increased consistently, reaching 142 in the third week of July. The KDCA said the country's medical care system can still treat COVID-19 patients, as the fatality rate is still low compared to previous waves of the pandemic. Nevertheless, health experts warn that soaring infections will inevitably lead to an increase in the death toll among high-risk groups such as senior citizens. The KDCA data showed that 83.1% of the seriously ill patients in the third week of July were aged over 60. And the same age group accounted for 98% of the death toll. What is triggering more concerns is the government's plan to adjust the COVID-19 infection classification level to Class 4, the lowest level, alongside the flu, from the current Class 2, as early as this month. As a consequence of this decision, the remaining indoor mask rules at general hospitals and other high-risk places such as nursing facilities for the elderly will be fully lifted across the country, and state support for testing and medical treatment costs will no longer be offered. Experts said the government should be more cautious before implementing this policy, as it could deliver the wrong message to the public that the COVID-19 pandemic is completely over. The government should tell people to continue wearing masks at hospitals even after such rules are legally lifted, said Lee J. Gab, a professor of infectious diseases at Hallam University Kangnam Sacred Heart Hospital. In response, A KDCA official said. We will continue to consult with experts and monitor developments carefully before making any decisions. The official added that the agency advises people to continue wearing masks when visiting places with a high risk of infection.